It is afternoon. I'm about 3 minutes late today. How are you? I hope you're having a great day so far. Welcome, welcome, welcome. And as you jump into the room here, I'll just be gabbing a little bit. So introduce myself. My name is Rebecca Becky Montrone. We have a business here in Keene called Wondrous Roots. And I am a holistic healthcare practitioner with a degree in holistic nutrition. And I am also a full-fledged herbalist. So I make a lot of different products out of herbs. So we do a lot of different tinctures, and we call them extracts now in the modern world. Back in herbal beginning days, they were tinctures. And then also skincare products, topical things for bug bites, and you name it. We make a really great bug spray, like an insect repellent, things like that. So we are open here 9 to 5, Monday through Friday at the Miller Forge Building, 103 Roxbury Street in Keene, New Hampshire. And our number here is 603-439-2603. Also, you can reach out to me from either of our websites, shopwondrousroots.com or wondrousroots.org. And when you go there to contact us, it comes to my private email. I'm the only one who sees those and answers them. So please feel free to do that. And I'm excited to be here on March 30th, okay, last Saturday of March. Tomorrow is Easter Sunday, and happy Easter to all of you out there. And I hope you're enjoying this really blustery. They say March either comes in like a lion and goes out like a lamb, or comes in like a lamb and goes out like a lion. But I think, as I recall, we've got lion on both ends. So we've got a lot of wind. Who cares? It's really nice and sunny out there, a little brisk in where we are in this part of the country today. So last week I talked about how you can participate here. As you're coming in, you can go to the Q&A and type, or you can go to the chat box and type, or you can raise your hand and I will call on you and you can talk and we'll all be able to hear you. And so that's really great. That's really fun. And I hope you will do that. Please feel free to come on in with any questions at all. And I'm just looking at my newsletter from today. I don't think I'll exactly maybe share my screen. Maybe I will eventually. But talking about magnesium, I had said that I was going to talk about that. I just read this book by Carolyn Dean, and it is called, she's an MD and an ND, and she wrote this, but she's written many books, but this book on magnesium is her latest, and it is Magnesium, the Missing Link to Total Health. She makes a great case here for how many conditions of health that we normally associate with all different causes and problems can actually be related to magnesium deficiency, and also explains how we end up so magnesium deficient, what it is in our diet, in our environment, and our supplements, maybe an imbalance there, that or lack of absorption that can really affect magnesium status in our bodies, and how many things that condition, that situation can affect. I think the good news is that if that's the case, then making sure one simple thing, such as making sure we're getting enough magnesium, should bear a lot of fruit, right? It should come to result in a lot of health benefits. And it's just one thing. And as you know, that's where I come from. That's my things. What affects the root? What's affecting the roots, so that the branches, many, many branches, will flourish as we nourish the roots. Magnesium is a big one. My first time I got really cued into this was 2003. She wrote her first book, Carolyn Dean did, Magnesum, the Magnesum Miracle. And my father gifted me a copy of that. And he was very taken, as a pharmacist, he was very taken with the idea of the magnesium oil, which is not magnesium oil at all. It's simply magnesium chloride, which is liquid, which has an oily type of consistency to it. So it's not like magnesium, like you press out the oil, like you would press out a seed or something like that. It's just magnesium oil has an oily consistency, and how magnesium chloride, magnesium oil, is so effective for really replenishing the body quickly with magnesium, because it doesn't have to go through the gut and deal with absorption issues there. And it is very readily taken up through the skin, particularly like the soles of the feet. And so anyway, we got all into, kind of caught on the buzz of the importance of magnesium. And then I reread last year I think it was last year, maybe the year before, her second edition of the Magnesum Miracle. And then I was sent this book in order to read it and review it, asked to read it and review it. And very, very, very well worth reading, not only for review, but from my perspective. She has tons of studies in here that I like to go back and actually type in, when you get the bibliographies, like these things, the references, go in and type them in and actually find the studies and save them to my files on different topics. Anyway, I thought I would kind of give you the cliff notes on this book today, just sort of give you the summary of some of the really important things she talks about and the takeaways that I have from reading it. I do have in my newsletter, and those of you who are here probably came through the newsletter, and if you didn't use an older link, and I'll share my screen really quickly for a second. I thought that this was really interesting and took the time to type them all out. She identifies 68 plus conditions that she associates with deficient magnesium status. And there's just such a list there. And she's got something to say in this book on each of these, like when it comes to like number 46, burning pain, needle stabbing, shocking. She's got something to say there. Restless legs, she has something to say there. Neurological manifestations, muscle weakness, you name it. So, I invite you, if you are interested in how, and maybe I'll just leave that up, how you can, if there's something there that you want to know about, like in that list or something like that, we can maybe highlight those maybe a little bit as we get going. So I'll stop the share for now, and then I will, we can come back and look at the list, and you might have it in front of you anyway, or right handy. But anyway, it's like, why are magnesium is a macro mineral, and it's really readily found in foods. If foods had the nutritional content they should have, especially when it comes to minerals. It's interesting in here, she does point out the study back in 1936. This was it was a committee, a Senate committee, and they were evaluating the soil sufficiency of minerals. And I'm trying to see, did I actually write down where that is? I can just tell it to you. So basically they were like, the soil was so depleted. I think they said like 80% depleted of minerals by 1936. That's astounding, especially when you consider how long ago 1936 was. And they also made the assumption, or maybe the hypothesis is a better word for it, that perhaps the reason people were getting fatter, that the nation was starting in 1936 to become more obese, was because people were eating more because their food was not nutrient rich. And so the lack of rich nutrients was causing people to eat more unconsciously because they needed more nutrition. And so they would eat more and get more calories and more of everything else, but they still weren't getting the nutrition that our food supply is supposed to have. And that right there is our biggest problem. Is I do have in my newsletter, I've got recipes of magnesium-rich foods, and that's all well and good, and that's great, and we should be eating those foods. But we really need to know, when it comes to magnesium, we have to supplement. It's like iodine, we have to supplement. In fact, when I was talking to Dr. David Brownstein, who wrote Iodine, the reason iodine, why you need it, why you can't live without it. He had said, I said, after I tested like 20 people in a row for magnesium sufficiency, iodine sufficiency, I asked him what percentage of his patients had been sufficient when he tested them. And he laughed and said maybe 2 or 3%. And I said, it makes me wonder why we bother testing. And he said, I couldn't agree more. He said, it's like magnesium. We know we need to supplement magnesium. We know we need to supplement iodine. So these are both minerals, right? Too. How important minerals are. We think about vitamins a lot, but minerals are super important. And magnesium is huge. Another problem with magnesium is that we get so much calcium, and calcium imbalances magnesium. Think about estrogen and progesterone imbalance, right? We say, oh, we're in a very estrogen dominant environment where our population is very estrogen dominant. Well, why? Well, one of the big reasons is because we get so much estrogen in our food, right? From the glyphosate, from the herbicides and the pesticides. We get estrogen from plastics. We get a lot of estrogen from people who use plastic in a microwave oven. We get estrogen from sunscreens. We get estrogen from the plastic bottles we're drinking out of, from all of our plastic use. So we have a progesterone, even though progesterone levels might be high in women at a certain time during their cycle, they're still progesterone imbalanced because of this excess estrogen. So this is where we are. We need magnesium. We need it for, she says 80%, and this was not her saying this, this is actually reported in a study, I believe. I had put it right there in my newsletter, but that 80% of our physiological functions basically involve magnesium. And so a lot of the things that involve magnesium are chronic diseases we see today so much of, and that would be heart disease. So heart disease, whether it be hypertension or atrial fibrillation or heart attack, stroke. The cardiovascular system is hugely dependent on magnesium. Magnesium is a natural calcium channel blocker. So here's kind of like, I'm jumping all around here, but just talking off the top of my head, and maybe sometimes that's a little bit easier to understand than if I'm just jumping around and reading, but I'm going to do that too. So the calcium, we have these calcium channels, and they're necessary to let in just precise, minute amounts of calcium for just a little tiny fraction of a hair of a fraction of a second at just the appropriate times. There are different things in our, talk about our diet that really cause big problems there. And one of those things is the MSG and the MSG lookalikes in food, the taste enhancers, the flavor enhancers, and umami, that's like a popular one now, like in Asian cuisine and things like that, or in Indian, things that are like that. But you can also get it like in soy isothanates, or bouillon, and all kinds of things. I've had lists of the excitotoxins out there before from Dr. Blaylock's book, Dr. Russell Blaylock's book, Excitotoxin, The Taste That Kills, autolyzed yeast, things that you find in processed packaged food. You have to watch your labels, but a lot of times they don't even have to say exactly what it is. It could just say flavoring or artificial flavoring or something like that, or just flavoring. So they can get away with a lot and you don't know what you're getting. This is why we go to a whole food diet as much as possible. We stay away from boxes and bottles and canned prepared foods because we just really can't be sure what's in them. But what happens when you ingest those things, they cause the calcium channels, right? Because getting back to the calcium channel blocking action of magnesium, they cause the calcium channels to open and to stay open for too long. and the calcium will rush in. And in the case of the brain, neurotoxins, the taste that kills, the brain cell will be killed. And so we're kind of killing ourselves with excess calcium in the body, getting where it's not supposed to be, when it's not supposed to be there. And magnesium is a natural calcium channel blocker. So really for the whole system right there, we want that there. That's what a lot of heart medications are. Oh, I've got you for your high blood pressure, we have you on a calcium channel blocker. The problem is with those medications, with many of the medications used to treat most of our chronic diseases, many of the medications deplete magnesium. So you may be diagnosed with a chronic condition that is a chronic condition, or maybe more than one. A lot of people with one chronic condition have another chronic condition. I have diabetes and heart disease and asthma, right? I got respiratory disease, heart disease, diabetes. Many of the medications used for those things, many of the reasons you have those things in the first place could be tied to low magnesium. And now the drugs they put you on for them further deplete your magnesium. And then it's like, oh, and now we need another pharmaceutical because now this is showing up. She's actually got a really good analogy, talks about that in a really concrete way. So I'm going to just read that. I know I can find it really quick. It's in the heart area. Oh, and another thing I have to say is that heart disease, is it in that one? Okay, so here's one. Here's a common scenario. Jack is 60 and he goes to his doctor for his annual checkup, but he's been under tremendous stress. The doctor finds that his blood pressure is a little high, probably from stress, which causes magnesium depletion. Which causes magnesium depletion. So stress itself, yes, she makes that whole point about the adrenals being under stress and how when the adrenals are stressed, it depletes magnesium, depletes B vitamins too, right? But it depletes magnesium. So the stress, number one, is depleting the magnesium. It's been a little high a few times in the past, so he's put on a diuretic drug. Okay, so those of you who are prescribed HCTZ, hydrochlorothiazide, right? Very common to be used in tandem with other blood pressure medications or by itself. When he comes back for a follow-up, his pressure is even higher. The doctor doesn't know why, but it's because Jack's magnesium has been driven even lower by the diuretic. So, oh my goodness, I did this to bring your blood pressure down, but now your blood pressure is even higher. This doctor knows nothing about magnesium deficiency. Carolyn Dean, who's a doctor herself, finally realized it was really kind of strange. Now I'm interrupting a story with another story, but I'll get back to this one. Okay, hold that. His blood pressure just went up, right? Okay. She wanted to write, she was watching what was going on back in, back in the 1990s with the whole regulation of supplements, nutritional supplements, DHEAS, I think it's called. It's not to be confused with any kind of DHEA or anything like that. But anyway, she was very involved with that. And she wanted to write a book on something entirely different in the natural health world. Her eyes were really starting to open up to what they were missing in medicine. And she asked Random House if she could write a book if they would publish a book that she wrote on some other subject. And they said no, but they really wanted a book, like a mainstream book on magnesium. And she was like, okay, she didn't know really anything about magnesium. And this was what really opened her eyes. But she found in herself that most of the health problems she had dealt with in her life were all due to magnesium deficiency. This is the author of this book, herself, Carolyn Dean. And she, anyway, I'll get back more into her story, how much magnesium she needed to really flood herself with in order to to finally correct those things and all of that. But now we're back to Jack, who had the high blood pressure because he was under stress. The stress depleted magnesium. Now he's put on a diuretic drug and to lower the blood pressure, because the idea is if we get rid of fluid in your body, there's less blood. It's kind of a torturous way of dealing with high blood pressure, is to dehydrate you, right? Well, I mean, think about it. Does it work? Does it bring the blood pressure down? Yeah. But I mean, how good is that for you to be completely dehydrated? Not good. So anyway, his doctor just thinks he's caught Jack's blood pressure early and he has to get more aggressive. The doctor puts Jack on 2 more antihypertensive drugs, so blood pressure medications. A month later, seemingly out of the blue, but in actuality, because of lower levels of magnesium caused by all 3 drugs, his cholesterol levels and blood sugar are elevated. Okay, so again, the adrenal glands, you'll see cholesterol elevate when the adrenal glands are under stress, because the stress glands need cholesterol to come up with the hormones they need to deal with the stress. So it's a vicious cycle. So now it's made a difference in his lipid panel. And now it's made a difference in his blood sugar. The doctor says he's happy he caught Jack's high cholesterol and high blood sugar in time and puts him on a statin drug and a diabetic drug. Both of those drugs drain the body of more magnesium. And so the story goes, as more and more magnesium is lost, the symptoms of magnesium deficiency escalate into full-blown heart failure. So this is very, very telling, isn't it? We start with something that is caused by, stress leading to depletion of magnesium, leading to elevated blood pressure as aldosterone rises, leading to being medicated for that, being put on a diuretic, which further depletes the body of magnesium. Now, oh my goodness, we're still seeing this. We're still seeing you still have high blood pressure, and you have high cholesterol and you have diabetes. So we'll put you on some more medications. And these medications all add to the depletion of magnesium. Of course, the original problem, which was magnesium insufficiency, it has not been even addressed. So think about how many people, think about whether it's you or whether it's your parents or it's other people in your family. I mean, I meet people all the time who come to see me who are on multiple prescription medications, or some of their loved ones are, and this is how it goes. And then, of course, the other side effects that go with these things. And I'm not saying that there's never a place for prescription medication. I would never say that. But I am saying, wow, look at this snowball effect of one health condition being treated with a medication, and never the real reason being addressed. Now, I will say, what's very interesting is that people will go in and say, well, I want to have my magnesium level checked. And they said my magnesium is fine. Well, they do a serum level of magnesium. And serum levels of magnesium tell us nothing very beneficial, because it's not about what's in the blood. The blood is just the highway. The blood is where things are before they get to where they're going, where they do their action. And they don't tell us what's going on in the tissues of the body that use magnesium. And so what's very important is to, and Carolyn Dean, this doctor, she developed a test to the ionic test, to actually test the tissues for the ionic magnesium. And she developed a form of magnesium that is taken orally called picoionic magnesium. I just switched to that myself a few weeks ago after starting reading this book. And because it's of a very small molecular size, and it enters the body through the small intestine rather than some of it moving into the colon now, because it's not absorbed into the tissues properly and loosening the stools. So that whole effect. People use like cheap magnesium oxide if they're constipated or if their stool is too hard to loosen it up. And that's great to do it that way because it's not a drug and it's not habit forming or anything. But when you do that, you're not replenishing your body with magnesium because it's not getting there. It's just helping you get your stools looser, because the magnesium that doesn't get into your body is in the blood, is in the colon as it's passing through your digestive system. and it attracts water from the body in through the porous nature of the intestinal wall, and makes the stool softer. So that's a kind of a roundabout use of magnesium, but it's not furnishing your body with any magnesium to help you. So if I can just go here, I thought I might. It's also really, it's also very frustrating because the kidneys are very, very dependent on magnesium, but magnesium, the magnesiums have to work to process magnesium. And so people are often cautioned if they have kidney issues not to use magnesium supplements. And it's just horrible. It's like, I had Fox News on one day, and that guy, their doctor, the older man, kind of rotund, who's their pundit doctor, who always just has the party line to share, was like, they were talking, it was in the news, something about magnesium. And he's like, yeah, magnesium is really important and everything. But then he ended his whole spiel by saying, don't ever take a magnesium supplement without talking to your doctor first. I was like, you have got to be kidding me, because you might have underlying kidney disease and you don't know if you have it, and you could really harm yourself. And there's a great story in here about a woman who was on dialysis, and they're very much warned not to use magnesium, and how it's great. If you're interested, get this book and read it. It's really remarkable. But the picoionic form of magnesium can be very safely used in people with kidney issues, and is very, very, very necessary for kidney health. So anyway, I'm just going to where Carolyn talks about she talks about her own problems with calcium, with magnesium, and finding that out. And if I can find it, I'll get to it. If not, I'll just blab on about something else. But yeah, I don't see it right at the moment, but she had what were her problems? She talks about sugars drain on magnesium. I know it was somewhere like right in here in the book. Well, looks like I'm just not going to find it. She had like cramps, she had muscle cramps, she had all kinds of stuff, things that you might identify with. So let me just again see if I can. I know she talked about this very early in the book. She said, once again, the key to find a non-laxative magnesium that's absorbed efficiently at the cellular level. As you build up your magnesium reserves, you need less magnesium, not more. And if you take more than your cells require, the excess is immediately eliminated. Magnesium is the only nutrient with this false fail-safe quality. In other words, like you can't take too much because your body will get rid of it. She goes, when I began to use my own non-laxative picometer, stabilized ionic magnesium magazine, I slowly worked up to taking 1,200 milligrams per day, which is like ridiculous. With other products, I couldn't take 50 milligrams without getting the laxative effect. I began to feel better very quickly from my neck and upper back pain, lower back pain, Charlie horse leg cramps, headaches, insomnia, and heart palpitations that I mentioned earlier that I can't find in the book. I know it's earlier. But it took me a year and a half to get to the point that I could stop taking my magnesium for a day or two and not experience symptoms. About a year into taking 1,200 milligrams, I gradually reduced the amount of magnesium I took to 600 milligrams a day. If I took 750 milligrams, I would start getting the laxative effect. I knew I was saturated. And since the cells in my body didn't need that extra 150 milligrams, it was eliminated in my stools. Presently, I only require about 450 milligrams of magnesium per day, which is probably due to the addition of a picometer potassium to my daily minerals. Now, it's very interesting there. She said, I mentioned earlier that I slowly worked up to taking 1,200 milligrams of my picometer magnesium. I also put it in a liter of sea salted water along with several other minerals and sipped it throughout the day. Additionally, if you take all your magnesium at once, it will become laxative because the cells are overloaded, making it both an inconvenience and a waste. So that's very interesting. But most people, even on her picometer product, she's got down a half teaspoon, which is 150 milligrams is your daily dose. So I tell people I've been taking a teaspoon, but it's probably better to do like a half a teaspoon. Like I do it with my liter of water in the morning, but I drink it all at once. Probably better to take like a half a teaspoon, and that would be 300 milligrams, half a teaspoon, like in the earlier part of the day, and do this again later in the day. Or if you want to just sip, over several hours time, you can do that. But I would never recommend to anybody like 1,200 milligrams. That to me is like, and it's not even, I don't know. I just wouldn't. I just think it's interesting that she did this herself. I would love to speak with her. Maybe I'll get a chance to do that. In any case, some of her fun facts about magnesium. She says a major factor in 68 plus conditions. She goes, these diseases include diabetes, heart disease, high blood pressure, high cholesterol, migraines, irritable bowel syndrome, and heartburn. I thought that was very interesting because I've never thought, when I deal with people with acid reflux, I've never thought about using magnesium. And yet she makes a great case for that. In fact, let's go to that particular, I think it's her first condition there, acid reflux. She says magnesium relaxes muscles in a constant push-pull with calcium, which tightens muscles to perform an activity. If there's too much calcium and not enough magnesium, muscles will go into spasm anywhere in the body, including the esophageal sphincter. A spasm of the lower esophageal sphincter at the juncture of the stomach. So that's like the little ring between the stomach and the esophagus and the stomach. So, so a spasm there at the juncture can leave the sphincter open, allowing acid to reflux up back into the throat, back of the throat, or even into the lungs. Some so-called acid reflux is not acidic, but rather an alkaline slurry from the small intestinal contents that flush back into the stomach. An added feature of stomach function is that the natural gastric proton pump is dependent on magnesium. Oh, and that's very interesting because people who have acid reflux are often put on these proton pump inhibitors. Well, the proton pumps are like super important throughout your whole body, and you're shutting them all off. But look at this. An added feature of the stomach function is that the natural gastric proton pump is dependent on magnesium. Specifically, a combination of potassium magnesium with ATPase creates the gastric proton pump, which acidifies the contents of the stomach, which you really need when you're eating, when the stomach phase of digestion needs a lot of acid. That's how it works. Ironically and unfortunately, proton pump inhibitor drugs that wipe out stomach acid also lower your magnesium levels. Okay, this is another drug that lowers your magnesium levels, which means escalation of esophageal spasms and lack of proper stomach acid to digest foods. The FDA has been forced to warn the public since 2011 that PPIs like Zantac can lower magnesium. It's interesting to see a new PPI drug called pantoprazole magnesium Protonix. Ironically, besides magnesium, Protonix contains 2 fluoride molecules, great, which increase magnesium deficiency when fluoride molecules irreversibly bind with magnesium, making a brittle compound called magnesium fluoride. Okay, so, wow. And fluoride also displaces iodine. Look at this. Think about this. When you're these drugs that people are just written prescriptions for day in and day out, these proton pump inhibitors. I've talked about them before. They're terrible for a number of reasons, but there's another one. So there we go. She claims, she says long COVID is the new face of magnesium deficiency. I thought that that was pretty interesting because a lot of people are complaining of that. And it's an interesting theory. She says, this section on long COVID summarizes most of the previous facts, but is also a standalone that you can pass on to people who are suffering from this condition. She said, from 1979 to 1992, in my medical naturopathic practice, I treated colds and flus with lots of fluids, vitamin C, zinc lozenges, and homeopathic remedies. There were no blah, 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 blah. There were no drug treatments for colds and flus, and antibiotics were contraindicated for viral infections. In naturopathic training, we learned that a bad case of a viral flu can leave you with lingering symptoms that we called post-influenza illness. I used to advise my patients that a flu or cold is beneficial mucus elimination, a way for the body to get rid of toxins and debris. However, I began to observe that colds and flus, instead of being a 24-hour purge, were lasting days and then weeks. In the early 80s, I began to see more and more patients with what became known as chronic fatigue syndrome and fibromyalgia. In my naturopathic training, I learned about yeast overgrowth and found it to be an additional factor in chronic fatigue syndrome. By the time COVID came along, our society was in the midst of a toxic tidal wave. As a nation, we suffer from vitamin and mineral deficiencies, extreme stress, overwork, environmental toxicity, and an inferior diet. All the above result in multiple health complaints, including obesity, which are blindly treated with drugs, more drugs, and surgery. Couple that with the immense fear that was whipped up by allopathic medicine and the media about COVID, which created a perfect storm of illness and devastation. Okay, she goes on. I want to see where she says. Researchers say that among the top 18 symptoms of long COVID, half of them are neuropsychiatric: memory problems, sleep problems, brain fog, anxiety, depression, smell or taste disorders, dizziness, and headaches. And this is where magnesium comes into the picture. Magnesium is required to power 80% of known metabolic functions in the human body, making it the most important nutrient for human health. If you don't have enough magnesium, you can suffer hundreds of symptoms that can be misdiagnosed as medical diseases and treated inappropriately with drugs. Most of the neuropsychiatric symptoms listed above can be found in people who have magnesium deficiency. Other long COVID symptoms affect heart, muscles, and nerves, and can also be due to magnesium deficiency, or I would at least say certainly not helped by magnesium deficiency. The medications being recommended for long COVID are the same ineffective ones given for chronic fatigue syndrome and fibromyalgia, and they can all deplete magnesium. The antibiotics and cortisone medications can cause gut dysbiosis, yeast overgrowth, which I consider to be the second major cause of long COVID. That's very interesting too, and I've not investigated that further. She says she's been working on the solution to long COVID since the mid-1980s when she was first treated patients with chronic fatigue syndrome and fibromyalgia. I start with magnesium, and that recommendation was presented in 1998 by Dr. Mildred Seelig, a noted magnesium expert. So again, long COVID, it makes sense. Make sure your magnesium status is that you're replenishing your magnesium on a daily basis, and you need to do it on a daily basis. I do have in my newsletter different forms of magnesium we have here. Again, I did switch to the picoionic form because she makes a lot of sense. It's also super cost effective, like 8 ounces. And if you're taking a teaspoon a day, which is 300 milligrams, is $29, 8 ounces. And she makes a big argument for its efficiency in the brain. So many of you know I take, and many of you do, and I recommend magnesium-l-threonate for the brain. And she talks about that in depth because she said all forms of magnesium do get to the brain, even magnesium oxide, which is poorly absorbed, but not much, and you would have to take a lot. But she talks about this picoionic form easily doing that. And let me see where she talks about that. Magnesium and calcium. Magnesium and zinc, magnesium, potassium. Well, I'll tell you what she said, because I read the book, so I can tell you. She basically said that there was a lot made of this when the study came out, when MIT invented this form of magnesium, a team at MIT invented this form of magnesium. And it easily enters the cerebral spinal fluid and crosses the blood-brain barrier, and it's excellent for the brain. But then she went to other tests showing that other forms of magnesium, of course, the brain is dependent on magnesium. So before this form was invented, the brain was certainly getting magnesium. But the fact that the picoionic form, this very small molecular size of ionic magnesium, is the brain is very available to the brain. And so I thought that was very interesting. I'm not quite willing to give up my MagMind. I love it. But I think she makes a good case for saying that's not necessary. So, magnesium-l-threonate is very expensive compared to other forms of magnesium. When it comes to calcium, and I've got this book, Death by Calcium, which is my next read. This is like really fantastic. But again, the problem with this is not that calcium is evil. We need calcium, right? But we don't need calcium supplements because we get plenty of calcium in our diet. That's something that we do get. Even if you're not a big milk drinker, you probably still are getting calcium. But she says here, I've always been wary of calcium supplements, and I went out on a limb when I wrote in the first edition of Magnesium Miracle that we should be getting equal parts of calcium and magnesium, a ratio of 1-to-1 in our diets, and if we take supplements. Back in the late 90s, when I read everything I could about magnesium, I saw that there was an unexplained consensus that you had to take 2 parts calcium for every part of magnesium. This 2-to-1 ratio is still evident in the composition of most calcium magnesium supplements and in most health books and articles I read. I traced this 2.2-to-1 calcium to magnesium ratio back to a 1989 report in the journal Magnesium Research by the famous French magnesium scientist, Dr. Jean Delac. His actual words, mistranslated from French, were that we should never exceed the 2-to-1 ratio of calcium to magnesium intake from all sources, food, water, and supplements. This was obviously misunderstood as a recommendation, not as an absolute cutoff point. That's pretty cool. So it was like, oh, it should be 2-to-1. No, it should never be more than 2-to-1. Like that's the max. So it's likely that people who eat dairy can obtain 600 milligrams of calcium from their diet. However, many people avoid dairy and don't get enough calcium. I suggest keeping a food diary of calcium-rich foods. If you don't get the 600 milligrams of calcium on average per day in food, you can supplement the difference with a picometer calcium supplement. So again, one that is appropriate. But this is not what's happening, right? Especially when it comes to osteoporosis. We have doctors saying you need 1,200 milligrams of calcium carbonate a day. Get your calcium and your vitamin D. And then the vitamin D is not countered or complemented with vitamin K. And so you're getting all of this calcium. You're getting vitamin D, which increases calcium absorption, but you're without the K. Now you've got all this calcium and vitamin D. And so the calcium, what does it do? It sits in your arteries. It collects in your soft tissues. It sits in your urinary tract, and it causes kidney stones and things like that, where you need to have less calcium. Magnesium, what does magnesium do? Magnesium dissolves that excess calcium. Magnesium will help dissolve the arterial deposits of calcification. That is calcium, coronary artery plaque, arterial plaque is 98% calcium. So this is what we have. We have people we're flooding them with calcium. They're not getting magnesium. And the calcium is all over the place in the body where it doesn't belong. We've got the calcium channels open way too long because of the excitotoxins, and it's compromising our brains. It's compromising our cardiovascular health. Says here, atrial fibrillation, the most commonly diagnosed heart arrhythmia, and it's currently reaching epidemic proportions. The incidence is increasing as yeah, it really is. As magnesium deficiency becomes more widespread as the population ages and as screening programs, including massive indiscriminate screening with the Apple Watch, document asymptomatic AFib. Such screening puts doctors and patients in a conundrum because doctors believe that most cases of AFib are secondary to heart disease, so the standard treatment is to medicate those symptoms to try and alter the course of AFib. Unfortunately, heart, cholesterol, and diabetes medications add to the problem by causing more magnesium deficiency. AFib is caused by an electrolyte imbalance. If we do not routinely test for magnesium and never properly test for ionized magnesium available to the cells, I say that most people don't have a heart condition causing AFib, but instead have a magnesium deficiency causing these symptoms. And it was so interesting because I met with a gentleman yesterday who's 77 years old, and he has had a massive heart attack in 2012, and he was on medication. He had stent at the time, and then he finally had bypass surgery a few years later, like 4 years later. And since it's been patched up for an abdominal or aortic aneurysm. And he is on, they have him on statin drug. They have him on a couple of antihypertensive drugs. And they have him on Coumadin. So, because he does have AFib. So Coumadin is really, talk about death by calcium. Coumadin, because, and this is like the big irony of using warfarin, Coumadin, in people with atrial fibrillation to keep them from having a stroke, right? But what does it do? You can't have vitamin K. You can't even eat a lot of leafy greens because they contain vitamin K. Vitamin K, by the way, when you supplement it, you can't supplement so much that it causes blood clotting. It doesn't. It doesn't do that. But vitamin K will mess up what Coumadin, the way that warfarin works. So people avoid vitamin K, and it's actually shown that the arteries become calcified in people on warfarin. So we have people on warfarin, Coumadin, to protect them from heart disease, and yet it causes heart disease. So in speaking with this gentleman yesterday, of course, this is always up to the individual if they want to do this, but my recommendation was to stop the Coumadin and to use serrapeptase and nattokinase instead to digest the fibrin in the blood, to keep the blood from being sticky, to dissolve any clots, to keep the blood thin, so to speak, but to not have that, and to add vitamin K to he was taking 5,000 international units of vitamin D3 a day, but no vitamin K and no foods with vitamin K. And so what forms arterial plaque is this. I'm actually going to go to my paper on that to just make that point. I can find that easily in my files. Because I think this is really worth seeing. Okay, so it says here, the side effects, could enzymes be a safer and more effective alternative to drugs? The side effects of prescription medications are no secret. For 4 years of researching natural health convinced Dr. James Howenstein, a board-certified specialist in internal medicine who cared for office and hospital patients for 34 years, that natural products are safer, more effective, and generally less expensive than pharmaceutical drugs. Here's what he has to say about Coumadin, one of the most commonly prescribed drugs for cardiovascular disease to prevent clotting. Quote, numerous health experts have been concerned for years that Coumadin was not effective in preventing vascular deaths, but also has problems with occasional serious internal bleeding episodes. German researchers found out in 2005 that long-term use of Coumadin produced increased calcium in the aortic valve and coronary arteries when compared to patients not taking Coumadin. That's what causes heart attack. Okay. Gary Gordon states that, quote, every patient on Coumadin is increasing the calcium content of all vascular tissues. The calcium content of arteries is now proven to be more dangerous than diabetes, elevated cholesterol, or hypertension. We must now try to educate patients. Patients taking Coumadin can be easily moved to safer anticoagulant therapy. And so, again, for that, I've talked about proteolytic enzymes before and probably certainly will again. Serrapeptase, nattokinase, these are proteolytic enzymes. Serrapeptase comes from the silkworm, made by the silkworm to get out of its cocoon. Nattokinase is from natto, a soy, a certain fermented soy. And they bring down, not only do they take care of the blood viscosity, the thickening of the blood, and but they also counteract inflammation, hugely so. And so very, very protective, very good for the brain, very good for the overall. I don't have cardiovascular disease, and I take both every day because they're just so good at keeping everything cleaned out and preventing those things from happening. I do have a first cousin who had his first heart attack at 42 and later died of a heart attack. My father, at very elderly age, did have heart attack. So, you'd be proactive, right? But it's also great for the brain. It's also great for dissolving scar tissue and adhesions and doing all these other things that are really good for you. And so, this whole calcium thing is very, very, and we talk about osteoporosis and they make it sound like without calcium is just one part of the equation. Just one part of the equation. And I think what I'll do is go to, let's see what number her osteoporosis is in the newsletter there. Where is that? Oh gosh, cerebral osteoporosis number 61. Not page 61, number 61. It says, I'll just read this part. We got time. A 2014 meta-analysis analyzed the association between serum magnesium levels and postmenopausal osteoporosis. 7 studies involving 1,349 postmenopausal women concluded that low serum magnesium is a risk factor for osteoporosis, and that's actually showing up in the serum magnesium test. With drug companies funding most of the osteoporosis research and only focusing on biphosphates like Fosamax and calcium, there are no large clinical trials investigating the magnesium connection in bone production, and there probably never will be. Reports that the osteoporosis drug Fosamax causes jawbone deterioration are evidence that it causes brittle bones. This side effect of jawbone deterioration has dentists refusing to place dentures and implants in women who are on Fosamax. The drug destroys osteoclasts and prevents bones from breaking down, but the drug companies did not reckon with the necessary bone remodeling function of the osteoclast. Without osteoclasts, okay, so this is the important point. Bones have no blueprint to follow, and calcium is deposited helter-skelter. X-rays of bones under the influence of Fosamax may appear dense at a glance, but when you look closely, you see that without the remodeling capacity of osteoclasts, the bone's internal structures are in complete disarray. These bones are brittle and they break easily. What are we doing to people? Magnesium deficiency is very common in women with osteoporosis compared to controls. But what happens when women take enough magnesium? In one study, postmenopausal women with osteoporosis were able to stop the progression of the disease with 250 to 750 milligrams of magnesium daily for 2 years. A group of menopausal women given a magnesium hydroxide supplement for 2 years had fewer fractures and significant increase in bone density. Another study showed that by taking magnesium lactate to provide 180 to 300 milligrams of elemental magnesium daily for 2 years, 65% of the women were completely free of pain and had no further degeneration of spinal vertebrae. Wow, but you're not being told that. We're not being told that in the mainstream osteoporosis doctor visit discussion. It's unfortunate that decades ago, the treatment for osteoporosis was simplified into the single battle cry, take calcium. Calcium still dominates every discussion about osteoporosis. It is used to fortify dozens of foods, including orange juice and cereal, and is a top-selling supplement. My father, who was a compound pharmacist, right? And he sold supplements in his shop. He used to have a website or whatever on a computer. And when people came in to buy, which he sold, calcium supplements, he would have them, he'd say, before you buy that, go fill this out. And you'd plug in what you ate for your general diet, like what you ate. And he'd say, see, you're getting more than enough calcium. He could have just sold them a calcium supplement. So anyway, one author in the late 1990s cited scientific studies that did not support large doses of calcium after menopause, as the calcification of soft tissue could be a serious side effect. A lot of women have this urinary urgency and incontinence, urinary incontinence. This is all that extra calcium was being deposited in soft tissue, causing atherosclerosis, hardening of the arteries, gallstones, kidney stones, heel spurs, breast tissue calcification, instead of being directed to the bones. And also, it's true what I was just saying, the urinary tract is big for deposition of calcium and causing bladder spasms and causing the bladder things not to work. The urethra and the ureters and the bladder. This warning has been bolstered by the multiple studies done by Dr. Mark Boland, who found that women who take calcium supplements are at greater risk for heart disease, as calcium builds up in arteries and causes atherosclerosis. The point to make here is that all the calcium supplementation in the past 2 decades has not prevented the epidemic of osteoporosis that we are suffering today. And I think that we can certainly say that that's true. I do highly recommend this book. It was interesting when I went on Amazon to see reviews. There weren't that many reviews, and people were like very disappointed. One person was like, I thought she was going to tell me how much to take. She does. I mean, you have to really read. And another person said there was just a lot of references and things like. I find this extremely readable and compelling to the layperson. And again, going through all these different things, muscle cramps, jaw spasms, says here, GI spasms, headaches, both migraine and other fibromyalgia, kidney stones, kidney disease. And again, she goes into that whole controversy here about magnesium in the kidneys, insomnia. A lot of times, we take our magnesium at night to help us sleep. Hypoglycemia. Magnesium helps regulate the production of insulin so that inappropriately large amounts aren't released, which can cause the blood sugar to drop suddenly, resulting in symptoms of low blood sugar. Hypertension with insufficient magnesium and too much calcium, the smooth lining, muscles lining blood vessels go into spasm and cause high blood pressure. If cholesterol is elevated, which can be due to magnesium deficiency, combined with the calcium, causing atherosclerosis and making the blood pressure higher. Atrial fibrillation, asthma. Says the smooth muscles of the bronchial tubes go into spasm when they are magnesium deficient. Magnesium is an antihistamine. Dehydration worsens asthma. There are many studies using IV magnesium formulas for the treatment of moderate to severe asthma in children and adults. Arthritis. It says here, a study in the Journal of Rheumatology followed 2,855 subjects. Investigators measured magnesium using the inferior serum magnesium test, and arthritis was determined by specific X-ray criteria. They found a significant association between low serum magnesium and osteoarthritis. Anxiety and panic attacks. Magnesium supports the adrenal glands, which are overworked by stress, leading to combined magnesium deficiency symptoms and adrenal exhaustion symptoms of anxiety, depression, muscle weakness, fatigue, eye twitches, insomnia, anorexia, apathy, apprehension, poor memory, confusion, anger, nervousness, and rapid pulse. Serotonin, the feel-good brain chemical, depends on magnesium for its production and function. Right there. Additionally, magnesium deficiency has been strongly linked to sleep disorders, which can either cause or increase anxiety. In a review of nutrients used to treat anxiety, all 3 randomized controlled trials of magnesium-containing supplements had positive results. Says studies in animals and humans suggest that magnesium may play an important part in the etiology, the cause, of affective mood disorders. A relationship between magnesium and affective depressive states has been established. So magnesium, we need it. It's easily depleted. If you're a person who drinks alcohol on a regular basis, it just totally zaps magnesium. It totally depletes your magnesium. So you'll find, if you've been partying or something like that, and you're getting leg cramps and stuff like that, that's because you just totally drained out. You totally got rid of all of your magnesium. So if whatever it is, especially if you're on medications, if you are somebody who drinks alcohol regularly, if you're anybody really, but if these are things that go on and compound your magnesium deficiency. So who needs to supplement magnesium? Everybody. But more especially, do you need to be careful if you're on medications, if you're on prescription medications, if you drink alcohol. I'm not sure the effect of caffeine or other things like that. But, and then Susan says to everyone here, you told me to use magnesium many, many years ago, and she still has the magnesium oil too, the magnesium chloride. Yeah, we've been talking about magnesium. I've been talking about magnesium for a long time and always recommending it. But when I read something like this, again, it brings it to light. It makes me think about myself. Making sure it makes me think about, my family members. It makes me think about my clients and others. So let's just be sure that we're doing that. And then Melinda is saying, magnesium almost completely got rid of my headaches. And I remember that, Melinda, that's right. That was magnesium that did that. So yeah. So it's super important. It's very interesting too in the whole, she's got a whole section on the neuropsychiatric things. She goes on and on and on about that. There's this huge list of those. She doesn't go on, but she lists a bunch of them, like hyper emotionality, she calls it. Anger, anorexia, anxious behavior, apathy, apprehension, impaired breathing, poor concentration, confusion, depression, dizziness, fear, forgetfulness, hyperemotionality, irritability, lightheadedness, lump in the throat, poor memory, nervousness, nervous fits, sensitivity to bright light, sensitivity to EMFs. That's a big concern of people lately. And some people are really very, very sensitive. So that's the first thing I would say is, yes, make sure magnesium. A 2011 study concludes that elevation of brain magnesium might be a novel approach for enhancing synaptic plasticity in a regional specific manner, leading to enhancing the efficacy of extinction without enhancing or impairing fear memory format ion. And they would be talking about there would be that magnesium-l-threonate. I'm sure that study was related to that. Muscle weakness, restless legs, pain, burning pins and needles, stabbing, shocking, things like that. Stuff that we just might just seem so vague, or you've lived with something for a long time and you're just used to it. And you're just well, that's just me. I have a twitch. Try magnesium, try getting magnesium up there. If you have questions about maybe how more direction on how to dose it, feel free to reach out to me. You don't have to make an appointment. You can email me or contact me from one of my websites. But generally speaking, I would say, 150 to 300 milligrams per day is, certainly where you want to be, and probably more in some instances. And the topical form, the magnesium oil, we have it in a gel. It's the same thing, but it's got some aloe in there, so it makes it a little bit of a different consistency. But that just means that it's magnesium chloride that you apply topically. And if I was really good at making sure I did that every day, I rely more on that, but I'm just not. I've tried and I'm just like, no, I already put my lotion on. I did this. Now I gotta put this on and I gotta put my tights on. I gotta wait for it to dry. So I'm just, that's not my thing. So I'm doing mine orally, but there are different ways to do it. So thank you. Thank you so much, Melanie. And it's a pleasure always to learn this stuff and to bring it to you. And I hope that you benefit from it. And what is the best magnesium to supplement with daily? Kathy is asking. So it depends on what you're doing. I really like this pico-ionic form. I think it's great because it's very accessible. It's accessible to the brain. It's accessible to all of the tissues. It's also in a very small molecular size so that it is taken up into the small intestine so that it doesn't get into the colon and cause that laxative effect. What you don't want to take is magnesium oxide because magnesium oxide just is like 2% of that is absorbed. And it will make your stools very loose. So unless you're using it as a laxative, as a natural laxative, don't use oxide. Other forms, we have one by Seeking Health called optimal magnesium. It's magnesium glycinate and malate. Malate that's bound to malic acid. The glycinate is bound to glycine. Malic acid is, excuse me, especially good for the muscles. Glycinate is very good for relaxation, sleep. They're fairly well absorbed. So I like that one. I like the magnesium-l-threonate that we have in the MagMind for the brain, but I would never just take that. I would always take another magnesium with it. For the heart, all of the magnesiums will work for the heart. The pico-ionic liquid form that I've talked about that Carolyn Dean formulated, I love for that, but magnesium taurate, is bound to taurine, and taurine is very good for the heart. So there are different ones. We use potassium and magnesium citrate to help oxalates from precipitating out and causing stone. And so you can use that if you're prone to kidney stones, but if you were getting adequate magnesium on a daily basis, it should do the same thing. And she talks about that in the book. And so, but anyway, there are different forms, and I would say you just don't want oxide. Citrate is good too, but citrate is pretty poorly. It will definitely have a laxative effect because it's not as well absorbed. There's some good combinations out there of different magnesiums together, but make sure you're getting magnesium and that you're getting enough and every day, because you're going to use it. You're going to burn it up. It's going to be depleted again. So something you have to make it a regular part of your diet, just like you do brushing your teeth and taking your other supplements. So I hope that answers that question. If there's nothing else, I will let you go. Again, have a wonderful holiday weekend, and I will be back next week. And